Gentleman yields back. Chair recognizes the gentlelady from Colorado, Ms. DeGette. 5 minutes for questions, please.
So much, Mr. Chairman. I note that we have a number of representatives of ADAPT here in the hearing room listening to this, and I want to welcome all of you. ADAPT was founded in Denver, my district, and I've worked with them and also the Atlantis community for many, many years. The Atlantis community is one of the oldest independent living centers in the country for individuals with disabilities, and they've really done courageous work over the years in educating all of us about why it is so important that we pass legislation that supports their independence and their ability to live in their homes and their ability to really lead the kind of productive American lives that everybody in this country should be able to do. So thank you all for coming out today. There are a number of pieces of legislation that they support, but one of them specifically is H.R. 5306, the Ensuring Medicaid Provides Opportunities for Widespread Equity, Resources, and Care Act. And I want to thank Congresswoman Dingell and Congressman Guthrie for sponsoring that. In Colorado, funding for the Money Follows the Person program is aimed at facilitating the transition of Medicaid beneficiaries from nursing and other long-term care facilities to community-based services. And since we implemented this in Colorado in 2013, we've already transitioned 214 folks with physical, intellectual, or developmental disabilities, mental illnesses, and other impediments to really being able to live in these community-based situations. Mr. Cunningham, I wanted to ask you, not only is this the right thing to do, but what I've heard is this actually saves money. Can you talk about the cost savings of programs like this?
Sure. So, yeah, it does. I mean, community-based care is cheaper than institutional care. We see, I mentioned in our nursing home fee-for-service, it's about $5,256 per member per month there, and in our home and community-based services programs, or our community-based programs, the PMPM on average is about $3,233. So that's a savings of about $2,022 per member that you're moving out. Given that their numbers, there's always acuity and all this other stuff, but that's just a broad stroke of the estimate.
And what are some of the other benefits to moving folks out of nursing homes and into community-based?
Well, I mean, there's a lot. So, I mean, we operate from the view of person-centered planning and informed choice. So once out in the community, through person-centered planning, an individual can really think about how they want to self-actualize their own life. Yep. And look at, employment, look at engagement with loved ones, with family and community, and quite frankly, engage in life and fulfill the hopes that we all have in our own individual lives.
Thank you. Okay, I want to talk briefly about this other bill. What's the number? It's a draft, the PBM gag clause prohibition. Boy, what an important bill that is. And I just want to talk for a minute to you, Mr. Chancey, about this. I've been for about the last year, Congressman Tom Reed from New York and I we're the co-chairs of the Diabetes Caucus, and we've been leading sort of an independent insulin inquiry, and we sent letters of inquiry to the 3 brand name insulin makers about patient assistance programs and drug discount cards. And for a lot of these patients, these programs are a lifeline. Now, in your testimony, you stated that pharmacists can counsel patients about alternative purchasing options in some cases, such as when patients don't present a form of insurance. If a patient asks about ways to lower their insulin costs at your pharmacies, do you counsel them about patient assistance programs and drug discount cards?
Yes, we do.
Okay. And as part of this consult, do you tell the patients and clients that these financial assistance programs may not count towards their out-of-pocket expenses such as deductibles and co-payments?
Yes, we do.
Good, that's great. Mr. Chairman, I'm hoping not just the PBMs, but the entire system of drug pricing is something we should be having hearings on. Right. And we should be doing it before the end of this year, because the PBMs are, it's ridiculous that they tell pharmacies that they have these non-disclosure agreements, but really it's throughout the system. And I think we could still do it. I don't know about all the rest of my colleagues here, but I was home in Denver for most of the August recess. That's all people wanted to talk to me about, was the cost of health care and the ridiculous cost of prescription drugs. Thanks, and I yield back.
Thank you.